on this episode of A Tale of Two Hygienists.
The view in Norway is very much everybody is equal, so everybody deserves the equality. So there's really no health inequalities there, right? As far as healthcare goes, everybody receives the same thing. Everybody has access to the same services, no matter what your income level is. It's very interesting. I will say one of the things that I loved about some of the curriculum in Denmark for dental students and dental hygiene students is that there's a huge focus on ergonomics, much more so than we have here in our country in school.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Hello and welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, episode number 470. I'm your host, Andrew Johnston. Thank you so much for being with us today. In this episode, we have the amazing India Chance on, and the episode originally, interestingly enough, was to focus on the difference for infection control procedures across the world. She's done some traveling recently, and as we got to talking, as we kind of got into it, we really leaned into the cultural belief systems that other countries have, and also how other countries view and practice ergonomics, but like it's an improved way of doing ergonomics, especially compared to, I think, what mainstream is here in the States. India said something that was really interesting, and it kind of struck me that for the most part here in the US, we try to practice, we'll say like ergonomics is an example, and we practice it like while we're at the office, but then we don't really have it top of mind in any other setting. Or sometimes we need to lose weight, so we're going to eat better. There's like a very specific purpose for the eating better, not for all of the systemic benefits, but just for losing the weight specifically. These types of things are a bigger part of the everyday life in some countries, and it's accepted by the society as a whole. So an example of this would be the Mountain Dew craze, right? We talk about that quite a bit, and how people that drink a lot of Mountain Dew have elevated decay rate. At the same time, it's accepted in all of society. And so in other countries, things like that would be forbidden, or they'd look down at you for making those types of choices. And I think that was very interesting. And there are lots of concepts like this kind of woven throughout this week's episode. You're really going to love this one. And then next week, boy, do we have a humdinger of an episode for you. We have Dr. Richard Lowe. To say that he went through some dark stuff would be a huge understatement. And we talk all about it, all the bad habits, the addictions. There's a really hard road that he took towards healing. He had to save his marriage, and he was very honest about all that. So we talk about some of those key pieces of his journey that anyone could use to learn and implement them into their own lives. It's not a dark episode by any mean, but he did go through some stuff, and I think that we all go through some stuff, and it was really nice to hear his perspective on it. Okay, I think that's all for us for this week. Thank you so much for your support and listening, and here is the conversation with India Chance.
A tale of two hygienists.
Welcome everyone into the interview portion of the podcast, joined today by India Chance. India, welcome to the show again.
Thank you so much for having me. I'm excited to be here again. It's been a while.
I mean, but how many times have you been on this show? I mean, you've got to be getting tired of it by now.
Yeah. It's been a couple times. Yeah.
Oh my gosh. Well, you're beloved by the host of the show and beloved by the guests and the audience of this show.
Oh, that's great.
So thank you for being here. The reason why I wanted to have you on though was I saw you had posted, I think it was actually on LinkedIn of all places. I don't follow anyone on Instagram, so I don't know if it was there. It might have been on Facebook, but I feel like it was LinkedIn, where you had gone on a trip, and then you were instead of like what most people do, like, "Hey, I'm gonna go to Europe and I'm gonna enjoy my vacation time." You're like, "Let's go see dental stuff." And you're
You
thanking
know?
somebody for giving you like a tour of this place. I'm like, "Wow, you are a nerd. You are
Yes.
top-notch dental
Yes.
nerd."
Yes, definitely a dental nerd. That was really the trip. I mean, I did get some personal time in there, with family in Norway, but the purpose of the trip was to go to Denmark and check out to see how they do dentistry over there. It really came about because the previous year I went to Finland on another dental trip, specifically for dental through the company LM Dental. And they invited me over because I'm one of their KOLs. And what they did was set up kind of like a summit where there were about maybe 15 of us from all over the world. And we all came together and we talked about, instrumentation. And they have a product and has to do with sterilization. So that's why I was invited and things like that, of course. But anyway, on that trip, I got to meet some fantastic dental hygienists from around the world, very experts in their field, very prominent in the countries where they're from. And one of those was Tatiana, and she is from Denmark. And we just really clicked and we kept in touch. And she invited me to Denmark and said, "Hey, why don't you come over and check it out and see what we do over here?" And I'm like, "I'm there." She's like, "I'd love to get your feedback on infection control and what your thoughts are. And I know you're the expert there, and please come and share and discuss, with our community what you're doing in America, and let's collaborate and let's learn from each other." And that's really how it came about. And she's connected with a lot of people in Denmark. Plan Dent is Plan Mecca, one of those companies. And that's what I did. And it was really eye-opening, but it was also phenomenal just to see, how dentistry is done in other countries. I know that you've been on trips, to other countries around
I
the
have, but
world.
not like not I don't wanna say, like, not first world nations like you have, but, like, what I've seen in the world is not well, so I
Yes.
guess that's actually a good question, though, is like, okay, so you went to Finland, you kinda probably met with some of these people that and you had an understanding then of maybe what you're getting yourself into.
Yes,
And
yes.
this is also Scandinavia. Scandinavia has a lot of similarities between the 3 countries, but
Exactly.
pardon me, I think there's 3, but
Yes.
sorry,
Mhm.
Scandinavia.
Yeah, yeah.
But they also like to be individualistic, though. They also are very proud
Absolutely.
of who they are. And so
Yes.
was there some assumptions made? Like, you're like, "Okay, we're gonna go here, and, like, it's gonna be the same, like, Denmark's the same as."
I think so. I think that I thought that because it was quote unquote Scandinavia, I just felt like every country that I visited was gonna pretty much be the same in respect to healthcare and things like that, and it's actually not. Like I said, I went to Norway first. I didn't go there for dental, that was personal, but, because we have family friends, I was able to really kinda dive into conversations with them about the healthcare system, and it's very different. Everything is very much socialized and provided by the government, over the top in Norway. It's such a small country, there's only 5 million people, and so what is provided in the healthcare sector, as far as even, dentistry goes, it's just astonishing what you can do. But of course, again, small country, 5 million people, they utilize oil money, things like that, that contribute percentage of that gets contributed to their healthcare system. So, what is provided by the government is would really blow your mind. Some of the things that they have access to healthcare wise. Going to Finland, it was a little bit different. We at the summit, we really discussed how we performed procedures. What was dentistry like? What were the dental communities? Are you guys focusing on? And again, remember it was from all over the world, but we definitely, because we
Beautiful.
were in Finland, we got a really good idea about, the Finnish healthcare system. Denmark is surprisingly, when it comes to healthcare, similar to the US. There is, you have insurance and there's copays and there's, fee for service, things like that. And so it's a lot different than somewhere like Norway, where everything is covered by the government and money gets put into your account to cover whatever for your healthcare. And so and it's my understanding that Sweden is different than Denmark when it comes to that. So, Yes, although they have similarities, when you say that they're very, very individualistic and they're very proud of that, that is so spot on. They you will be corrected if you make certain assumptions and things like that very quickly.
I wanted to follow up on Norway though, because that is interesting. I think what our friends to the north, our Canadian friends,
Sure,
have
yeah.
a sort of socialized medicine, not necessarily dental, right? But it's a little bit different.
Yeah,
But you hear some of the complaints about that too, right? That it's
sure.
hard to get appointments, hard to do these things because it's such a small country. Are they still seeing similar issues with the dental side of it?
Uh, no, I would not say so. Because it's such a smaller country, I think their model is a little bit better. It's easier to implement because of the amount of people, and their view on their citizens is very different, I would say, than some of the other countries that I have visited. Although, like the UK and Canada, their socialized medicine, the view in Norway is very much everybody is equal, so everybody deserves the equality, so there's really no health inequalities there, right? As far as healthcare goes, everybody receives the same thing, everybody has access to the same services no matter what your income level is. It's very interesting. You'll notice that on the outside of homes, just to kind of give a little bit more perspective, on the outside of homes, there's not a lot of embellishments. Everybody appears the same. You don't purchase vehicles that, like we've seen here in America, people get extra features and things like that. They don't really do that in Norway. Everybody kind of stays the same because you don't want to quote unquote brag about, what you have versus your neighbor because it's really about equality. Now, when you
Ugh.
go inside someone's home in Norway, it is like out of Architectural Digest. I mean, it
Oh,
is
geez.
they
Yeah.
that is where so you'll notice a lot of home interior stores. You'll notice a lot of items to decorate inside of your home are sold everywhere. So with that being said, that kinda spills over to the healthcare side as far as everything being equal. So, the government will actually put money into their bank accounts to cover certain things that they like, for instance, our family friend who we were visiting has celiac disease. She gets money from the government that is, deposited into her account to purchase food items that are gluten-free specifically
Oh,
for
wow.
celiac. So if she has a dental issue that maybe is related to a condition that she has, she would let the government know, go through the channels, and then if they feel like, "Oh, are experiencing this because of your celiac, here's money to cover this." So, it it's socialized medicine, but it's a different model than versus, let's say, the UK or Canada. I have family in the UK, it's very different. Yes, they have socialized medicine, but if you want a private pay, you can. They have that there in Norway, but there's really not a reason to really
Sure.
kind of do that. So you don't see a lot of that. You don't hear a lot of that type of language and conversation when you're talking about, dentistry and things like that. Because I definitely had conversations with them while I was there about that. So, again, socialized medicine, but a little bit different model, and I think it has to do with the population. There's 5,000,000 people. You can do a lot with
Mhm.
5,000,000 people versus the amount of people we have in the UK or America or Canada, you
Yeah,
know?
that's like a large city for us.
Right, it's New
Yeah,
York City, so it's
exactly.
like you can do a lot with that amount of people.
Eh, does this lend then to a healthier population because they all have the same access, or are there still the people that are like, "I'm just not gonna go to the dentist, or I'm not gonna get my checkup?"
Well, they still have that. That is an issue that they have. I think on some respects, they have a healthier maybe mindset. They do this attention to healthcare does spill over into the food industry. So they don't allow a lot, the EU, they're part of that. They don't allow a lot of certain types of ingredients that are harmful to your health. They don't allow certain chemicals in food and in skincare products that are harmful to your health. So definitely it spills over. However, you do still have a lot of people. I think it's just human nature. If something's not hurting, what am I going to go to the dentist for? I mean, that's just to me across the board around the globe. If it's, they do when you are a child, they do have education for parents around when you need to start bringing your child to the dentist, just like we do. They have a push in the schools to definitely encourage and educate around going to take your child to the dentist and getting that early childhood care, which I think is important. And we've seen that work very well in our country when we started doing that. But again, you still have, everything is covered. I was told everything is covered until it's either 18 or 21. I can't remember. And then where they're seeing the dip is once they graduate university and they get a job, it's like, "Eh,
Yeah.
I'll go, whenever. I'll go when I get time." And they are
Yeah.
seeing a dip in that in Norway. Yeah, for sure.
That's fascinating.
Yeah.
That's incredible.
Yeah, yeah.
Uh, so infection control is kind of like your forte.
Sure.
It
Yeah.
is. You
Yeah.
are the expert in it for me as well.
Yeah. Yeah.
Um, are there I mean, tell me everything about this. So I'm or my brain is right now is like, okay, are there different type of chemicals used to disinfect? Are they different modalities of applying it versus like a spray versus a wipe versus whatever? Is it an important feature? Is it not important? Is it medical, healthcare facility grade? Like what's going on in probably
Denmark. Yeah.
Denmark?
Well, Denmark is where I really kinda got behind the scenes. Norway was more just conversational and things like that. I would say there are a lot of similarities. What's surprising to me is that a lot of the countries do look at the CDC for kind of guidance. They don't necessarily, it's kinda like a reference or a resource. They don't necessarily say, "Yes, we're gonna write our rules and regulations according to the CDC," but it is pretty it's prominent, you can see it, it's prominent in a lot of the regulations. Like in Canada, they will reference the CDC as their,
And don't some of our states also reference it, but then
Yes.
some will, like I say, well, they institute it as well, right?
Yes, exactly. So in other countries you'll see the same. I've read over different rules and regulations and standard of care for certain countries, and you'll see they'll reference the CDC guidelines for dental settings for that. And again, it's literally in other countries, it's pretty much a guide, but you'll see the differences when it comes to certain protocols are more strict, and then you have some protocols that I would say from an infection control standpoint are less strict. They're not as stringent as we are. And so I think both countries, both US and Denmark, could learn from each other. For instance, when you walk into the clinic, one of the first things for me that was pretty prominent, and this I was at the school, and this is pretty much, I'm told, across the board, they do observe changing your clothing. You change out of your street clothing and you get into your clinical PPE. So your scrub top, your scrub pants, shoes, they change shoes and everything. In the dental school, everything is white. Everybody has to, from head to toe, everybody's in white. And you walk in, and again, one of the first things that's pretty prominent to me is nobody wears jackets. You're not allowed to wear a jacket. So it's short sleeve. Everything is short sleeve. So you wear a short sleeve scrub top. So your top, half of your top of your arm and your forearm is totally exposed. In questioning that, the response was, "Yeah, we feel like, we perform hand hygiene up to the elbow, and we feel like that's sufficient, and we haven't really had any cases where there's, like, cross-contamination and, those types of things, and we feel that that is sufficient." And so, of course, my infection control brain is rolling because I'm thinking, "But what about the hair?" And, it's like a sponge, and what if somebody has, an injury or, what, oh my god, that kinda thing. Even from patient perspective, I don't know that I would wanna walk in, and if I see somebody with a cut on their arm, I want to actually see that, those types of things. But I have to remember that they've never had that. So their perception is much different than mine, right?
It's very
So,
practical, their perception of
yes,
things. Yeah.
yes, yes, yes. One of the other things, as far as their disinfection goes, it's very similar to ours, either a spray or a wipe. They don't do anything different. Of course, their equipment looks a little different. If it's a dental chair, yes, but the handles on the suction look a little different. They use different manufacturers than we do. Some of the manufacturers are still the same and they have different models of equipment than we do, but everything is pretty much the same. I will say one of the things that I loved about some of the curriculum in Denmark for dental students and dental hygiene students is that there's a huge focus on ergonomics, much more so than we have here in our country in the school. Yes, we talk about it. Yes, we maybe we have a course on it. We discuss it with students and things like that, but they go, I feel, many more steps further. They implement all ergonomically designed chairs. That's part of the grading. Yes, here it's part of the grading here in this country, but the problem is, what I've noticed in our country is we say we want you to focus on ergonomics, but we don't necessarily have the equipment to support that. Right?
Yes.
In the schools,
Yep.
right?
Yep.
And they've gone that extra step and said, "We want you to focus on ergonomics, and here's how you're gonna do it. We're gonna give you an ergonomically designed chair. We're only gonna purchase ergonomically friendly instruments. We're going to have a course completely dedicated to ergonomics. You're going to be graded every time." Like, they just go that extra mile with that, and
Mhm.
as we know, pretty much most of the stuff you learn in school, how you learn it is how you're going to take it into the field unless you get that continuing education around that topic, right? Otherwise, if you never take a continuing education topic around, let's say, ergonomics, you're just going to do what you did in school,
Well,
you
and
know?
even if you do take that, it
Yeah.
maybe you take 5 or 6
Yeah.
courses of it because it's hard to change
Yeah.
behavior.
Exactly.
It's cemented in you, and it's like, "Oh, this is kind of
Exactly.
muscle memory."
Yeah, yeah, exactly, and it's hard to unlearn, and things like that, and so they really do support that. So that was something that really stuck out to me because they are, I would say, a little bit more health conscious when it comes to the clinician's body and the longevity of their career than I would say maybe we are. I feel like we've made a ton of strides since I was in school. I graduated 2003 and didn't really talk about any of that. I would say the last maybe 10 years, 7 to 10 years, we've seen a big push for it, right? And now it is at the forefront of clinical, but we're still in this country fighting against, leadership sometimes to say, "Hey, I can't do this because my body is hurting," or "I need to have this chair because of my ergonomic health," and things like that. And in Denmark, you don't see that as much. You see the acceptance. Well, first of all, they're aware. There's an acceptance. You see leadership embrace it outside of the dental clinic, or the dental school. I had the opportunity to provide a course around human factors, and that was one of the things that we talked about, human factors and ergonomics, to the Denmark dental community. These were all leaders and dental hygienists and dentists that were in the community, and there is an acceptance and an embrace of practicing ergonomically correct so that you can have longevity in your career and you're not harming yourself to provide dentistry to your patients. And so that was pretty profound to me because I know the struggles that we have still in this country around not just ergonomics, but a lot of stuff, right?
Well,
In
I mean,
dental
and I don't
hygiene.
wanna, put, too many notions on this practicality, pragmatism thing, but when you think if you just sat down and just thought about it for a minute, if I'm a leader, if I'm trying to hire, we'll say, a hygienist, and I don't want turnover, I want them to be in my office for
Right.
30 years with me as I'm
Right.
practicing.
Right.
I should invest the extra $100 or the extra $20 or whatever it is,
Right. Exactly.
to make that happen. I don't
Yeah.
understand
Yeah. Yeah.
sometimes how we put the dollar before the person, to a ridiculous extent. It's not even a little bit, like, it's a
Yeah.
dumb extent.
Yeah, yeah, and I think that that's where we need to grow in dentistry as a whole. I think it's about thinking about long term. I understand that as a dentist, you have to run a business. It's not just providing dentistry. You're also running a business. So, and you're in the business of dentistry per se, and things cost money, and you have to meet a certain, you have to meet that bottom line, right? Because you have to pay everything. There's a dollar amount
Mhm.
attached to everything, down to the 2x2s that we use, right?
Yep.
So I get that, and I understand. I'm a business owner, completely understandable. But one of the things that I've learned in, you know, business development is making sure that you take care of that team. So, like you said, you don't have that turnover. It's such a domino effect when you don't invest that $100 or that $200 into your team. I've seen it. I walk in as a compliance consultant. I walk into offices all the time and I see the leaders that invest in their team and the ones that don't, that do the bare minimums. And you can see the difference. You can see the turnover rate. You can see it trickles down and even sometimes into the quality of the dentistry that's being provided. Of course, the safety of the dentistry, because that's what I'm always focused on. And so I think just kind of shifting our perspective a little bit. Now, as a dental hygienist, I feel like we have a responsibility to this equation as well. It's not just on your dental practice owner or your leadership, right? It is also you making sure that you get educated, making sure that you understand what's going on. And we'll just use ergonomics, like understanding ergonomic health, knowing, okay, what am I doing with the equipment that I have right now? What could I improve, right? It's not always about running to the dentist or the leadership to say, I need this, I need this, I need this, right? You do have to look at, are you utilizing what you have right now correctly?
Mhm.
Is there room for me to get more education around that? Or is it a situation where, you know what, this equipment is actually causing my ergonomic injuries and I need to have a conversation? I would say step 2 to that would be, now you gotta learn how to have the conversation, because it's not just go in there and stomp your feet and pound your fist on the desk and say, "I need this," or "I'm leaving." I think that's not good because, you basically hold your dentist in a hostage situation, and if, hostages don't like to be there, they wanna get away, right? They don't wanna be held captive, and
Right.
so they don't like their captor, you know what I mean? So it's like, I think there's, like, just a lot of education that we need to get as hygienists around some of these things, but yeah, I mean, I know we're down a rabbit hole, but that's kind of what stood out for me a lot when I was over there in Denmark, just seeing, their perspective, but I think it's a societal thing, Andrew. I think it's just as a whole, that's how they look at, like, a lot of things. It's not just, dentistry and stuff like that. It just goes back to, like, them not allowing certain ingredients in food and not, the government, you know what I mean? It's just a perspective from the top that I think trickles down into all industries, including dentistry.
Well, because all these industries are interconnected though,
Yeah,
right? I mean,
exactly.
if we talk about even from, like, the earliest things about sugar and, like, okay, what sugar
Yes.
does to your body and all
Yeah.
the different parts of your body,
Yeah.
that by itself
Yeah.
is, like, a
Yeah.
whole long conversation.
Ye
They're getting it. There's
yeah.
also other ingredients, there's other stuff. I think I don't know. I think big picture on some of this stuff though is, like, I do wanna stay down the rabbit hole for just a quick minute
Sure, sure,
about
yeah.
your
Yeah,
ergonomics
sure,
and the
sure.
hygienist.
Yeah.
I think that you're right that I think the hygienists do also need to take responsibility in this because if they are hurting or if they're in pain or whatever, they can't just assume that their doctor's gonna know, that the business owner is
Yes.
gonna know that they're in pain or that they need something changed or they need all these other things. So that's number
Exactly.
1. Number 2, there are some things that are like must changes and some things that are nice to change, right? I would
Exactly.
prefer if I had this type of saddle stool versus this other type of chair or whatever.
Right.
And if it's a
Right.
preference, I think that you need to invest in yourself because also you can't come out in 25 years and be like, "Oh, they screwed me over in year 7 because they wouldn't give me a chair." Well,
Absolutely.
it's like, "Well, you knew it was happening in year 7. Why didn't you change it yourself in year 7?"
Right.
Or
Right.
I like your way the most, obviously, is if there's a compromise that we can make with the business owner to invest in whether it's me or the next person or the next person,
Right.
um, then I think that's ultimately the way to go. And I think there's also incentives. I think that we can make it fun. I know hygienists don't like talking about production or whatever, but
Sure.
maybe if you made some sort of a goal where it's like, "You know what? As the preventive specialist in this chair right now, I am going to do 10 sealant. I'm gonna find 10 sealants to do on adult patients this month.
Yeah.
We're gonna
Yeah.
bill it out and stuff I wouldn't normally be doing, right? Because
Sure.
I'm always
Sure.
focused on something else, even though I should be doing it, but I don't do that.
Sure. Sure.
Like, well, then that's paying then for the tool, the instrument, the chair, the whatever. Like,
Yeah.
we're working together with that business owner. I think there's definitely a way to do it and to make it fun and to make it interesting and different.
Absolutely. I mean, I don't think it's a situation where we've got to go out and prescribe unnecessary dentistry. There's plenty of dentistry, undiagnosed, untreated in all of our patients that's legitimate that we could, say, "Hey, have you thought about sealants? You don't have any cavities in these teeth. Have you thought about that?" Have the quick conversation with your patient. Maybe it doesn't happen at this visit, but then it might happen at the next visit, you know what I mean? But we have to understand that things cost money. And
Mhm.
if in and dentists have budgets, and if they have budgeted their money down to the penny, which most of them have, then you have to find another way to bring in more money. Now, that doesn't mean that you're money hungry. That doesn't mean that you're not a good clinician. Again, like I just said, there are legitimate things that we can offer our patients that would actually encourage better outcomes for them and educate them, because maybe it's just something that nobody's ever talked to them about. I was a temp for a long time. I would go into offices and I'm having conversations with patients and they're like, "Nobody ever told me I could get that done." And I'm like, "Well, you can and you actually need it." You know what I mean? And I get it because sometimes you're so close to the situation and, somebody new coming in, you see things a little bit differently. But dental hygienists sometimes get scared when you start talking about this because it's like, "Oh my god, you're trying to tell me to sell dentistry that they don't need." No, that's not what we're saying. We're saying that there are procedures and there are services that we can recommend to our patients that it's not just cosmetic. It's not just, you know what I mean? Like unnecessary. For instance, does your patient need ortho? They could probably be fine without it, but would it help them to have a functional smile? Coming from that perspective, maybe looking at it a different way. I'm a big advocate of hygienists taking on the mindset that you are a practice within a practice. You are a dental practice within a practice, and you should treat your operatory as such. You should treat your patients as such. And so if you see something that a patient needs, make that recommendation. Maybe, if you work in a state where you can't diagnose and things like that, then, bring that up to the doc before they walk into the room. Those types of things. Or, "Doc, can you check this? This is what I found. It was a little sticky here," whatever the case may be. But also when it comes to your equipment, if you want to produce high quality dentistry, understand that this room, this operatory is your dental practice and you should approach it as such. And so if you did own this dental practice and you had a certain amount of money, but you want this saddle stool, what do you have to do to get the saddle stool? And that means, well, I've got to create another stream of income or increase the income. Well, how do I do that? And so looking at it from that perspective, I think we need a little bit more education around that. And more business conversations is what I would say with dental hygienists, because we are employees. That's the traditional model. And employees have very different perspectives when it comes to budgets, when it comes to production and time per patient and we're not always, unless you're a hygienist who works on production, you're not thinking about how much this chair produces per hour or every 45 minutes. You don't even know how much it costs from an expense. You know what I
Yeah,
mean? Like
it's
we
true.
just
Oh,
don't. We
this
don't.
is the world I live in, trying to teach people this stuff. So I totally hear that.
Yeah.
Hey, I mean, you've lost the whole audience on the business of dentistry talk, but it's fine. It's fine. Well, we're really
Yeah.
back in. I have
Yeah.
one more question
Sure.
for you.
Sure.
And the reason why I thought about this is there's an episode of Brooklyn Nine-Nine. I don't know if you ever watched that
Okay.
show, but
No, but
it's
I've heard of it. Yeah.
hilarious. And I
Yeah.
want to say that these ones are Swedish, I think, but it doesn't
Okay.
matter. There's two like detectives coming from a different country or whatever, and they are not funny.
Yeah.
And
Yeah.
it's funny that they're not funny. Do you find the people that you run into we'll say, sorry, broad stroke it, but Scandinavia in general, are they funny people?
Um, I will say yes, but you have to, it's not like in America where you'll walk up, "Hey, what's going on?" Very animated. Not that at all. You have to, they keep it close to the vest, but then once you get, they learn you and you learn them, that's when the funny comes out because and I have found, which this is the type of comedy that is my favorite. Dry humor is my
Yes.
absolute favorite. Office was, like, one of my favorite shows, and now Animal Control is very funny, but that's sorry, I'm just, like, very dry humor. Seinfeld, those types of comedy, and so what I have found personally for me is that is a lot of the comedy that and the humor that you will see in Finland and Norway and Denmark. That's what I noticed. Very, very
Oh
funny
man.
people. Yes, yes, and
Well,
fun to
I'll
be
say
around.
take your word on that until I get you to meet some of
But you
them.
gotta scratch the surface. They're not like
Nice.
you're not
That's
gonna see
tough.
that right off the bat. You gotta get to know them, and they certainly have to get to know you. Yeah,
Yeah.
for sure.
India, thank you so much for this. If anyone want to check out what you're up to, where can they find you?
Learn2prevent.com. That's LEARN, the number 2, prevent.com. And then on social media handles, it's LinkedIn. I'm not on there a lot, but when I am, it's India Chance. But every other social media handle is Learn to Prevent. Definitely check us out.
Thank you so much.
Thank you.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.